Hello everyone, I am Dr. Murali Manohar Chirumamilla. In this video, I am going to talk about dizziness and tips to reduce this annoying symptom. Most of the people, they suffer from dizziness or lightheadedness. Actually, if you suffer from this type of problem, you will feel annoyed. It will be horrifying, but in fact, it is not that much horrifying. The dizziness, what it is? It occurs due to the disturbance in body's balance system. Actually, we have got a balancing system in our body, especially in the inner ear. Suppose this balancing system is disturbed, then you will have this dizziness. Then what are the contributing factors for this dizziness? This you have to know. The foremost important contributing factor is fatigue. If you are fatigued, then you will have the chances of getting this giddiness. And in the same way, stress also can contribute to this dizziness. And foremost important thing is anemia. If you have bloodlessness, then you may suffer from this dizziness. In the same way, anxiety, it contributes to dizziness. And among all these things, the most important thing is inner ear infections. If you have recurrent colds, say for example, then you may suffer from this problem. And there are other common disorders also. In the same way, many chronic conditions associated with aging can contribute to this dizziness. What are they? For example, diabetes. If you have diabetes, then you can have dizziness. In the same way, if you have heart disease, for example, you can suffer from this problem. In the same way, high blood pressure also. And the most important thing is hardening of the arteries. This is called arteriosclerosis in medical terms. If you have this problem, then eventually you can have this dizziness. So these are all the contributing factors or causative factors for dizziness. And there are few ways to stop this topsy-turvy sensation. I am going to tell you one by one. These are the excellent tips and these are easy to follow. If you follow these tips, trust me, you'll be free from this problem. First and foremost tip that I would like to tell you is lying down. Just lie down. For mild dizziness, the best thing you can do is lie down. Just lie down, relax and wait for the dizziness to go away. If you lie down, automatically the dizziness will go. Often the sensation will disappear within a few minutes. Say for example, within 5 minutes or 10 minutes, if you lie down, your dizziness will subside. But there is one important thing. Elevate your legs to stimulate blood flow to your brain. If you elevate the legs, what happens? The legs are the reservoirs of the blood, especially the calf muscles. In the calf muscles, there is plenty of blood. If you elevate the legs, automatically the blood that is there in the legs will be redirected into the brain, so that your dizziness will subside. If you are at some social occasion, say for example, excuse yourself, take a break and lie down on a sofa. This is one thing. Alternatively, there is other tip. Stretch out in a chair with your feet as high as possible, at least higher than your heart. This is important. So you have to raise your legs above your heart level. How you do it? Just sit on a chair. Then you put your legs on another chair which is opposite to you and elevate your legs above your heart level. Then with this position, you will be relieved from this dizziness. Say for example, if there is no place to lie down, then what you do? Just retire for a minute, go to flushing toilet, sit down and lower your head between your legs until the dizziness subsides. This is also a good trick. Just lower your head like this, put the head on your knees, sit for a while. With this, the dizziness will subside. And about the meals, about the food, eat 3 times a day. This is the most important thing. See, skipping meals can result in low blood sugar. And this low blood sugar or hypoglycemia is a common cause of dizziness. Similarly, some people will eat unusual food. So similarly, this eating unusual foods like all liquid diet can create a mineral imbalance in your body, and this could cause this wooziness or dizziness. So what I want to say, eat at least 3 well balanced meals a day consisting of 3 to 5 servings of fruits and vegetables, 6 to 11 servings of bread, cereal and other foods made with grains, 2 to 3 servings of dairy products like milk and cheese, and 2 to 3 servings of meat and fish if you are a non-vegetarian. And another important tip, reduce salt intake. This is the most important thing. See, too much salt in the diet causes the body to retain fluid. This is simple physics. We have studied in our lower classes. This is called osmosis. So, too much salt will result into this. This can disrupt the working of the inner ear. See, in the inner ear, there is a fluid. If you take too much of salt, then this working will be disturbed. So, what you have to do? Avoid cheese, avoid pickles and avoid salty snacks. And another important thing that I want to tell you is, read package labels carefully. Reach for foods that are having no salt added. At least select foods being low in sodium or reduced sodium. Another idea is, use herbs, spices and fruit juices to season the foods, so that you will not require more salt. And another important suggestion about the movement. Rapid changes in head position, particularly when you shift from lying down to standing up, can cause dizziness. This is the important pathophysiology of dizziness. So rapid movements will cause the dizziness. So what you have to do, move in stages, in steps. Say for example, if you are getting out of bed, you want to get out of bed, then what you have to do, sit on the edge of the bed for at least 30 seconds, then you can stand. So sit at least 30 seconds before standing. This is the $1 million trick. With this, you can reduce this annoying symptom. And among all these things, the most important thing is exercise. Exercise specific exercises will reduce this dizziness. Practicing the very movements that cause dizziness can help your brain learn to compensate for the problem. As a starting point, do 3 repetitions of the exercises that I am going to tell. Do these exercises 3 or 4 times a day. Actually, these exercises are designed to stimulate the balance sensors in your inner ear. These are supposed to make you dizzy. So what you have to do, you should do these exercises in sitting position, sitting in a chair or other some safe place or some comfortable place. Why? Because you are in a sitting position. Then you will not fall if you become dizzy. Because you are supposed to, you may feel dizzy with these exercises. Actually, you are training your brain. While doing these exercises, always keep your eyes open. This is the most important thing. So, while doing exercises, you have to open your eyes. You should not close your eyes. Okay, then what are these exercises? There are 2 main exercises, horizontal head rotations and vertical head rotations. We will know one by one. First, horizontal head rotations. Start in a sitting position, looking straight ahead. You have to sit in a chair. You have to look straight. Then, turn your head all the way to the right. You have to turn like this. Then, the important thing is, keep your chin parallel to the floor while turning and move it towards your right shoulder. So, turn and move towards right shoulder. Then you have to do the same thing in the opposite direction. That means turn all the way to the left like this. Go from side to side. Slowly increase the speed of rotation of your head as much as you can in 20 seconds. How you know 20 seconds? You can count 1, 2, 3 with slow pace. So you have to repeat these exercises for 20 seconds. Then rest a few seconds. And next exercise, vertical head rotations. How you do? Start in a sitting position first, with your head turned a little like this. This is the base position. As if you are looking at an object to your right, you have to turn the head like this. Then your chin should be parallel to the floor. This is important. While doing so, you should not elevate the head. So it should be parallel. Your chin should be parallel to the floor. Then move your head so that your left ear moves towards your left knee. That means you have to bend your neck. Left ear towards left knee. This is crucial. That means your ear will not touch your knee in this position. You will have to bend your neck only. Move in this direction until your head is horizontal, usually about a foot above your knee. Then alternate between the sitting and bending position. That means you have to bend like this, again coming to the sitting position, again bending, again coming to the sitting position. In this way you have to do quickly, as you have to repeat this for 20 seconds. Take rest for few seconds. Then do the first two steps in the opposite direction. That is, turn your head to the left like this, and then move your right ear towards your right knee. Alternate between these two sitting and bending positions as quickly as you can for 20 seconds. Okay, these are all about few suggestions, but there are certain warning signals that you should not neglect. If dizziness is unexplained, severe, recurrent or persistent, you should not neglect. It is a dangerous signal. And if you also have difficulty in speaking or swallowing, you should not neglect it. And if you also develop sudden weakness, numbness or tingling in one side of your body, you should not neglect it. It is a dangerous signal. In the same way, if you have a severe headache, then that is a warning signal. And in the same way, if your vision suddenly gets worse, then that is a medical emergency. You should not neglect. And if you develop double vision also, that is a warning signal. In the same way, if you also have ringing in your ears, then that is a medical emergency. You should not neglect. In the same way, if there is sudden loss of hearing in one ear, then that is a warning signal, and this is also you should not neglect. In the same way, if you feel dizzy after a fall or after a head injury, then that is a medical emergency. That is not in the range of your health tips. You have to take the medical help. Hope these tips are useful for you all. If you do not feel alright even with these simple tips, then you need to call for the consultation. This condition can be treated very well with proper Ayurvedic treatment. Anyhow, thank you very much for all your affection. Keep smiling, keep shining, keep doing well. Good luck. Subhamastu.